Okay, so
She doesn't go out. We do all, but I have to get. She goes from home.
sure. Put your computer and send the new link out to people. Let's hope there's sound.
Oh.
We're going to wait till 7:25 to begin, so that people are link at the money. Technical difficulties. We'll have to do it the old-fashioned way.
That's not correct, right? So
4 minutes. Sorry, I do not know why.
So they can hear us now and see
You
us.
were live
already?
right now.
Yeah. Okay.
My apologies.
Good evening, everyone. It's Derek Rumble here. We had some difficulties getting connected, so we are just going to give folks a few minutes to get reconnected with the new link. Your patience has been appreciated, and we will get to the business at hand very shortly. Thank you. And I'll try to monitor the questions from here, okay?
Okay.
Actually, you'll see that.
I don't think I can see that far though.
know it's uncomfortable. Minute. Once again, it's Derek Rumble here. Apologize for the technical difficulties, but we are live with the new link. If you have the ability to share the new link with people you know who are waiting as well, that would be terrific. Do appreciate your patience. We will get underway now. I'm going to turn it over to Shirley, and we'll try to get through this without any more difficulties. Thank you for your patience and understanding.
Welcome, everyone. As Derek said, we're sorry about the delay, but I'm glad that we are able to meet tonight, and I have a number of things that I want to discuss with you, and so I'll get right into it. I just want to say I hope everybody had a great summer and looking forward to a really nice fall. What we really want to do is ensure that our residents are safe. And at the same time, we want families to be coming back in to be reunited with their loved ones. And so with the changes that were announced last week, we really felt that we needed your guidance and your assistance in making some difficult decisions. And that is related to, as I sent out in my letter to you, resident absences. We're concerned about the community spread. Back to school starts next week. There was an article which says Simcoe Muskoka Health Unit sees troubling trend with local COVID cases. And Dr. Charles Gardner has said, we've had a growth in the pandemic. The most significant driver for that would be people socializing among family members, larger groups, and potentially beyond their social circle of 10 people. Also, last week, there was an outbreak declared at Mill Creek down the road where a staff member tested positive, which meant that all the residents in the home were undergoing testing. And those numbers have only increased since this particular article came out. So what we thought we would do is we put together a survey monkey. I always want to say monkey survey, so forgive me if I flip those around. We sent out a survey yesterday, and I know it was short notice. I sent out 91 emails, and I had 44 responses. So I would like to share with you the responses that we received, which I find is very helpful in what we're planning to do. So the survey was very short. It only had 4 questions and then a place for comments. The first question was, do you plan to take your loved one out of the home for a day trip? The responses to that were 11 people answered yes, and 29 people responded no. The next question was, do you plan to take your loved one out of the home overnight for an overnight stay? 100% of 39 respondents said no. The next question, would you support the home if we strongly advise families not to take residents out of the home at this time? 37 said yes, 2 said no. The next question, would you consider waiting another 2 weeks in order to allow us to monitor the increase of COVID cases in the community? The response to that was 38 yes and 2 no. And then there was an opportunity for people to make comments. And I just want to share some of those comments with you. I really feel the residents are safer in their current environment. Why take this kind of a risk? I'm only reading parts of some of the comments. The home and staff have done an amazing job in keeping the residents safe. I'm very grateful. My concern is the mental health of the residents. They have been secured at the home for such a long time with limited activities. They need more time with their loved ones. In most cases where businesses, schools, sports, etc., have opened their door, there has been an increase in cases. We all need to be patient, stay safe, and that means staying inside. We'd like to see indoor visits be easier to set up and go in the early evening for families that work full time. I would like very much to be able to hug my grandmother and get close to her. She knows I'm there, but I understand why I can't. It's very fragile balancing act in long-term care, and any wavering in protocol at this point would be irresponsible. Let history be a lesson. Ask these questions to a family that has lost a loved one in long-term care due to COVID-19. We would love to take our loved one out, but we want to ensure its safety to do so, especially when using Barrie wheelchair transit. I would like to have a COVID-19 test and be able to bring dinner in to spend with my mom. I do not support this policy change and believe it not only puts individuals at risk significantly, increases risk for other vulnerable home residents. It would be preferable to monitor the increase of COVID cases in the community before allowing a short stay absence for other than health care reasons. I want my father safe. Bob Rumble is doing a good job. Fully agree not to have residents leave the home at all. Thank you for your hard work in keeping Mom safe. Please keep the residents safe. This is a recipe for disaster, especially with schools and churches being open as well. Too many hugs, kisses, and cuddles. Can't resist. I'm finding the isolation of COVID very mentally unhealthy for Mom and would like the freedom to go into her room for a visit. You people are doing a great job. Would like to take resident out, but feel that it is important to keep aware of the COVID numbers and if it is safe to do so. The staff have done a phenomenal job in keeping our loved ones safe this past 6 months, and we are not out of the woods yet. I see no reason to risk people's health at this time. As much as I would love to resume regular visits, I feel we need to be careful. The timing of this opening is concerning. I would love to take my uncle out for the day to see his family and friends, but I will only do so when COVID-19 threats are minimal and when the admin of the Bob Rumble feels it is safe to do so. I disagree with taking residents out at this time. I believe that the very cautious approach taken by Bob Rumble has allowed our loved ones to remain safe. Ontario is still registering cases and transmission is still occurring, even though contact with people who you are unaware of, they are infected. The tighter we keep the circle for residents at Bob Rumble, the better. Families need to seriously take into consideration when they take a person from the home, how it will affect my family member upon their return and all the compromised residents that are unable to leave the home. I won't take my mom out. However, I do think it would be very risky at this time. I believe there's going to be a second wave or a strong continuation of the first wave in the fall. I think you need to wait at least until November. My reason for taking out a resident on September 15th is for a specialist appointment. Otherwise, I would not likely risk it. We've done a magnificent job since COVID became an issue, so let's not rush things going into the fall. I can wait to be safe, and so can my loved one. Keep safe. Wait at least 1 month before letting anyone out. See what happens in the schools. So as you can see, the comments speak for themselves. And based on the comments and the responses and what's going on in the community, we have come to the decision that we'd like to wait 2 weeks and not change any of the protocols at this point in time. In 2 weeks, we will survey you again and have another meeting and look at ways that we can slowly, over the 2 weeks while we're observing, we'll also be looking at ways that we can begin to reopen and have families coming in as much as a safe way as possible. So we need that time to be able to figure out how things will work, what the consequences of our decisions will be. So that's what we would like to do going forward. Having said that, I did want to share some other information with you. Currently, the bus is out getting its safety inspection. Starting now, just be them getting out of the building, getting on the bus and going and having a drive. So we're hoping, that will help you feel a little better knowing that your loved ones are getting the opportunity to actually get out of the building. There are some other changes that are occurring with our staffing that I want you to be aware of. Sorry, I've lost my place. So staff are now being allowed to, we haven't actually told them this yet, we're telling you before we tell them, is that they can begin to work in other non-healthcare settings. When the ministry's directive came saying, excuse me, that staff could not work in other healthcare facilities, we broadened that to say we didn't want them working anywhere else while they were working for Bob Rumble. Also, if the staff end up having to go to places like RVH, they no longer have to self-quarantine for 14 days. Something that I do want to share with you is we were told today that Mr. Ford would be making a new announcement about visiting and long-term care. That announcement hasn't come as of yet. And so whatever I'm talking about today could be different tomorrow, but I will keep you updated. I don't know what the changes in visitation for long-term care entails, but you will receive an email from me and information from me. And if we need a meeting, then I will ask Derek if we can set up another one. Just to let you know that when COVID hit, we were able to hire a number of nursing students as the universities closed down. They are now returning to school. Some of them are going to stay on and work for us on weekends, which has meant that we have been scrambling and planning and strategizing around how we can get more staff in here, as all the other homes we're competing with every other home. So I'd like to say that Chris Ware has actually hired 11 new people. And just give you the breakdown as PSWs. 4 of them are PSWs, 4 are RPN students, and 3 are RNs who are from other countries, but they'll all be working as PSWs here in the home. We are also having issues with RNs. We're short, a couple of people have resigned, but we do have agencies that we call upon when we have holes in our schedule, and the agencies have stepped up and we've been able to fill all the holes at this point in time. We're also going to be hiring 4 new resident assistants, and I might have mentioned this earlier in the summer. So the resident assistant, they're not PSWs, they don't have their certificate, but they would be helping make beds, put laundry away, answer call bells, help feeding and portering of residents. This will free up the PSWs to be able to do the personal care that the residents require. They're working very hard to make sure that your loved one continues to get the best possible care. I noticed in one of the comments that someone was asking about visitation in the evening. We're having, as I've mentioned, staffing difficulties. So along with having to have our PSWs and our nurses, we have to hire people who will assist with visits and will also do screening. So what I was thinking is perhaps we could take 1 night a week and look at extending the hours for visitation so that families that are working will have an opportunity to come and visit their loved one after they've worked. So we will get back to you on that idea. Yeah, so in terms of the screening and the visiting, just to remind you that we don't receive any additional funding for this, so we have to try and work with it with the resources that we have. So I think that was all my news. And if you have questions, I'm happy to answer them. If you have concerns and you want to call me, please feel free to do so. I will be in the office tomorrow. Derek, are there any questions?
Hello, everyone. It's Derek, and I appreciate your patience with us this evening. The information that we're sharing with you, it's new. It's not the best news that we're not back to normal, because we're not. We're going to be living and providing the best care for your loved one in these days the best way we can, and we appreciate your patience, and our success is because we've had good family cooperation, and it doesn't work without that, so we appreciate that. Questions came up, Shirley.
We're all struggling.
Yes, we will post the link. We will post the link for the recorded version of this, minus all the technical issues. Circulate that now. Channel, which is funny. So we have another question that says, if I visit my mom in the garden, and where can I hug her?
So at this point in time, we are not changing any of our protocols. So you visit your mom in the visitation booths, and the hugging is done through the hugging stations. This is going to continue as is for the next 2 weeks. And then we're going to revisit it and start opening up. So at this point, my answer would be, you can't just go out into the garden and hug mom. Is there another question?
Well, some of them have been blessed because they could not hear anything that I am saying, and I apologize for that. So if someone can just send a quick note saying if they can hear us now, or is it the computer just wants to hear Shirley? Well, I guess the computer just wants to hear Shirley. So I'm going to get Amy to say on my behalf that the success that we've had is because we've had great partnership and families who worked with us and cooperated with us in this very trying and very challenging time, where we wanted to provide the best care for your loved one. And sometimes we made unpopular decisions, but they were for the benefit of your family member that was here, and we will continue to do so. We get guidance from the province pretty much on a daily basis, and we will always take that into consideration. And sometimes the public gets information before we do, and we react in the best way that we can. And our driving force, the motivation that we have, will always be to make sure that your loved one has the best quality of life, that they're safe, and that they remain healthy, and that the challenges that they're facing in their senior years don't get complicated because of an outside issue. We will get there. We will get back to what something will resemble a normal. We know how important it is in the care and the quality of life for the seniors to have their family members do anything from say hello, to give them a hug, but to let them know that they're not forgotten, because I can promise you that they're not. And we will get there one step at a time. We will revisit you in 2 weeks, if not before, depending on what, if there's any more if there's any new directives from the province, we will get back to you. But most of all, I just really want to say on behalf of the board and on behalf of the staff here, that it doesn't work without you helping. We have colleagues and who are providing care across the province, and we have never had to say in any of our conversations, oh, you should meet this family member. We have never had to do that yet. We've had to listen to stories like that. And for that, I will thank you for being part of a solution and not creating another problem. We'll get there. That's our promise to you, and our vow to you is that we will provide the best care for your loved one. We will connect with you electronically, and as Shirley said, you can
Can you bring it closer?
hang on. We can hear you when you're facing the camera. All right, well, my apologies for my face. Congratulations on your decision regarding allowing the residents to leave the premises. Better safe than sorry. We understand what you're saying, and thank you. Thank you for all you do. You have the whole center's best interests at heart, and God bless. Well, he does that every day, I can promise you that. Very happy with your cautious approach in the care of residents and staff. So again, we're going to wrap this up. And again, any concerns, you can email staff directly. And sorry, my apologies. Email shirleycastle@bobrummel.org directly. And every time that I do get to visit with you, I will thank you very much for lending us your loved one. And even if it's just to get the weather, June, I thank you for that. And again, your loved one is our loved one. And thank you for joining with us. And we will work out our technical difficulties and try to be on time next time. And again, thank you for joining us. Okay, take care.